Okay, let's get started. Welcome to today's webinar on tips and tricks and some basic understanding of how to use the BioFlex personal therapy system. I've been hearing a lot of, or getting a lot of questions from all of you out there that are using the system. And I thought this would be a nice year-end kind of webinar to go over some of the commonly asked questions and understanding of how to use it, and hopefully it answers a lot of your questions and maybe gives you some useful tips on how to get the most effectiveness out of your BioFlex personal therapy system. If you haven't actually watched webinars before, my name is David Kanashko. I am the medical director here at BioFlex Laser Therapy, based in Toronto, Ontario, Canada. These webinars are always recorded, and it takes about a week or so, maybe two, it all depends, to upload them onto our website. And also, you should receive an email with a link to watch it again. Again, that takes a good week, sometimes longer, to get out. So as long as you register, you'll get that email. But even if you don't register, you can certainly watch it again or watch the webinar when it is uploaded onto our website. So I'm going to talk a little bit about the personal therapy systems, including the new one that we have, the Miniport Home, and then how photobiomodulation or light therapy, red light therapy, how it works, what you're hope to achieve with it. And then I'll get into some of the tips, especially around safety, precautions, maintaining and using your equipment, specifically how to use it to get good results, and some suggestions on treatment applications, and then I'll have time at the end for some Q&A. If you have a question for me, please type it into the Q&A box. And if you want to chat amongst yourselves, you can use the chat box. Okay, so currently we have actually three different types of consumer use therapeutic devices that we refer to as a personal therapy system, or the Miniport Home. You can see what they look like in this diagram. The personal therapy systems, there are two types. There's a P120, a P180. They're controlled by the same controller unit. They have the same number of protocols and anatomical areas to treat. The main difference being the size of the treatment array and slightly increased energy density or dosage with the larger array, the P180. Of course, that means you can cover more tissue in one application. And the Miniport Home, which has a similar array to the P180, although it's actually exactly the same as what we use in our professional devices, so it's a little bit more powerful than the personal therapy system. As well, it has an integrated software program that has more protocols, and I'll talk a bit about that as we go along. The key to all these devices is our use of a combination of red and near-infrared light, which is not new. I mean, lots of people use it, but typically, or always, they'll use diodes that are pretty far apart. So if you look at any device out there that is LED based, you'll see that the LEDs are really far apart, and they're typically, or always, one wavelength. So they'll have maybe a red LED, and then they'll have a near-infrared LED. So when you spread them that far apart, the energy density is much, much less. And they do that in part because to engineer it so they're close together and have a high energy density is quite complicated and complex. And we've been doing this for 30 years. A lot of proprietary and patents that we own in order to do this, to dissipate heat and get increased dosaging over a surface area. We also are the only manufacturer to use bicolor LEDs. So each diode emits the two wavelengths. So we don't have to separate red and near infrared. They all come out of one diode. Initially, it's red, and then followed by the near infrared. They don't occur at the same time. The reason really for that is that it's good to actually do the red first, which treats a superficial area and uses a lot of the photoacceptors are used up, or at least activated, and therefore allows the near infrared to sort of bypass those acceptors because they no longer accept light and allow more of that energy to go deeper. So in fact, by doing red, the near infrared, you allow the near infrared to go even deeper. And again, the main differences between these devices really revolve around the size of the treatment array, as well as the energy produced from the lowest amount of P120, obviously so therapeutic, to a little bit more in the P180, along with the larger surface area, and then even more so in the Miniport home. Excuse me. Still getting over this respiratory infection. I don't know. It's taken a while, but anyway. I am coughing occasionally, so excuse me. So the personal systems, that is a P120, P180. They have 4 levels of stimulation. You can see at the bottom right here, treatment stage or treatment level. There's 4 bars, 1 to 4, and is controlled by both the P120 and P180 by this small portable handheld device, which obviously allows you to take the device wherever you want to go, vacation or cottage or wherever it is that you're going. And it's obviously the most portable of our systems. There are 12 anatomical areas that you would choose from. So essentially you would choose the anatomical area that is closest to what you're treating, right? So if I'm treating hip, I'm going to use the hip protocol. If I'm treating in and around the hip, like your thigh or quad, I'd use the hip protocol. Then you get down to the knee. If you're treating anything around the knee joint or just below the knee into the calf, use the knee protocol. Ankle, foot, I think that kind of makes sense. The new Miniport home has been released this year, and it actually has 6 stimulatory levels. So instead of the 4 that are in the personal therapy system, there's actually 6 levels, and these are based on our professional grade of equipment. So you have a lot more flexibility when it comes to using a protocol or light sort of parameters. One size doesn't fit all. People respond differently for different reasons. It could be hereditary, it could be skin color, it could be the nature of the condition that you're treating. Lots of factors go in there, and you need to kind of find what works the best. And you have to play around with sometimes these protocols. The more you have at your disposal, the greater ability to sort of find the right fit for yourself. So this Miniport home would have about 24 more protocols than the personal therapy system. So provides a little bit more greater flexibility and options when you're treating different conditions. Okay, so those are the personal systems that we offer here at BioFlex. As far as how light therapy works, red light therapy, or really the terminology is photobiomodulation. There's lots of different hypotheses out there. Some have been proven with good science, and the main mechanism of how it works, and this is really based on decades and decades of research, is the light gets absorbed by specific photoreceptors, right? So photoreceptor, if you think about it, the easiest way to understand that is in your eye, in your retina, you have photoreceptors in cells that absorb light, and eventually they're transferred to your brain so you can visually see. That's an example of a photoreceptor. And there's lots of these photoreceptors in the body. And typically when they absorb light, they may interact with that light because that light has energy, and it may cause a reaction. It may cause a photochemical reaction or a photomechanical reaction. Not always. Sometimes it's just absorbed and nothing happens. Sometimes it absorbs, it causes heat. Really, it all depends on the wavelength. But in the case of red light therapy, what happens is when you have cells that are metabolically impaired due to inflammation, usually, or injury, you have a buildup of a molecule called nitric oxide. And this basically outcompetes oxygen in your cells. And you need oxygen to produce energy, or ATP. So when you have more nitric oxide than what you should in the cell, it inhibits the production of energy in the cell, and therefore the ability of cells to replicate, repair, regenerate, and help with the healing is impaired. What the light does is it actually interacts with the nitric oxide and causes it to break away or disassociate. By doing that, it allows oxygen to bind back on to the photoacceptor in the mitochondria, thereby allowing for more ATP to be produced, or energy. Therefore, you accelerate healing of tissues, and that's really what it's used for. It also has a mechanism in reducing inflammation, and that's because the cells are affected in a positive way with respect to its anti-inflammatory properties if it's a white blood cell, for example. So there's lots of other mechanisms at play, but this is the main one at how it works. So normal healthy cells don't really react too much to light, these wavelengths, but if your tissues are impaired due to arthritis or an injury or inflammation, and that's 99.9% of what's going on, it's going to be helpful. So it has an impact on circulation, and the mechanisms there are quite varied, but one of the main ones is through angiogenesis, or production of new capillaries and growth of blood cells over a period of time, but also the release of nitric oxide in the blood, and this causes temporary vasodilation. It can also help with collagen and scar tissue formation when you're repairing. It can help improve the repair process, and even to some degree atrophy of muscle tissue, what is caused by different conditions. It can have an effect on the immune system to help with inflammation, as well as reducing inflammation will help with reducing edema or swelling, and it can help different cell types repair, including nerves and cartilage and bone and so forth. So how our equipment essentially works is that when you first place the light array or pad on the tissue, red light comes out. Now, red light is a really good wavelength to use, and I won't go into the reasons why. It's kind of complicated, but I've done that in the past. But red light doesn't penetrate very deeply. So it's kind of hard to see here, but you can sort of see this red light. It's this graphic representation compared to near infrared light that can go much deeper. So by using the red light, you're actually targeting a lot of the superficial structures and tissues. You know, there's lots of them there. It goes maybe 5 to 10 millimeters in depth. That's the metric system, of course. And near infrared can go much deeper, several centimeters, maybe 2, 3, 4 plus centimeters, and there's lots of variations there as well. So the near infrared can reach even deeper targets in your body. Obviously, some targets are really deep, so it's hard to get to them. And how the light gets to those is a different conversation that I'll mention. Now, I mentioned the target are photoacceptors, and they're in mitochondria. Mitochondria are your little energy-producing organelles in all cells, really. All cells have mitochondria except for red blood cells. So the more mitochondria in a cell, the more reactive they will be to light. So if you look at the number of mitochondria per cell type, you can see that there's lots of mitochondria in muscle cells and liver cells, less in skin cells, and some other cells. But notice that nerve cells have a lot of mitochondria. So nerves respond extremely well to light, but you don't need as much light dosage when you're treating nerves compared to some other cell types. And you may wonder, well, I don't care about all that crap. I just want to put the device on and hope it works. Well, great. The thing about this is that if you just buy a device and you're left to your own devices, you're going to have to know all that. But if you buy a device that has been tested and used for decades, and the dosages are put in there specific for different regions or conditions, i.e. Bioflex, because we've been around 3 decades, longer than all the companies combined, then we actually know what we're doing. So you just have to choose preset protocols. It makes it a lot easier. The other thing that we do is we pulse the light. And you may wonder, well, why would you want to pulse the light? I mean, you just want to get light to the cells, right? Well, except you don't want to flood the cells. I mean, if you're old enough like myself to know that internal combustion engine cars back in the day were a little finicky to start, especially even motorcycles, and you had a choke, and you had to get the right gas air mixture. And if you applied too much gas, it would flood the carburetor and it wouldn't start. So if you flood the cells with too much light, you actually don't create this positive photobiomodulation effect. But when you turn the light on and then turn it off and then turn it on again, that's what pulsing does, then you actually give the cell the energy in small little packets that it can utilize and do something with. And then when it starts to become depleted, you give it more light. And so when you pulse the light, it actually makes the efficiency of photobiomodulation better. And Bioflex has been a pioneer in understanding pulsing and using it effectively to treat many different conditions. And this is built into all the protocols, all the stages that you're treating. You typically don't see it because, especially in near infrared, it's invisible wavelength, so you don't see it. It's also pulsed at pretty high cycles per second, so high that even if it were visible, it goes so fast your eye can't pick it up. Now, to understand light therapy, one needs to understand the wavelengths that we use. And if you looked at the electromagnetic spectrum, everyone's aware that certain wavelengths that are really short and high energy, like ultraviolet X-rays, gamma rays, they're ionizing radiation. And of course, they're extremely dangerous, right? Because they can cause cancer. And then as you get longer wavelengths, less energy, and therefore that's considered non-ionizing radiation, like infrared light, visible light, microwave radio waves, right? Much longer wavelengths, and they don't cause cancer like ionizing radiation. Now, the wavelengths used in red light therapy, well, of course, red, but we also use a small segment of the near infrared band. Notice the infrared band is huge, but we use a very small portion of it close to the red. And the reason for that is complex, but that's the main difference between an infrared sauna and infrared red light therapy, is that infrared sauna uses much longer wavelengths to target water to heat it up. Beneficial, yes, but works completely different than photobiomodulation. So that's another question I get asked a lot. Infrared in saunas and infrared in red light devices or photobiomodulation are the same category, but much different as far as the length of the wave and the energy that it has, and therefore what it targets. So our devices use red and near infrared. You can see the wavelengths there if you're interested. And remember, these wavelengths don't pose a risk, right? So it's important to understand that photobiomodulation has been investigated, researched, and clinical trials have been published for decades, well over 2,000 randomized control trials. There hasn't been one that has been published that has said there are side effects. So we know, and we can confidently say that when you use red light therapy, it's not going to make your condition worse. It's not going to cause any negative effects, but you need to use the right parameters and dosage to get the effect. And many people that buy cheap devices from, wherever, and they have zero instructions, or they don't understand how to use it. They have no idea what the energy is. They have no concept of lots of different things. And then it doesn't work a lot of the time because it's hit and miss, right? And then they say, well, red light therapy is nonsense, right? Well, it's nonsense if you don't understand it. So education is the key. And if you're watching and would like to learn more, I have now 20, 30, 40, I don't know how many webinars I've done. I'm going to have to retire soon on our website. So if you're interested, just go to our website. They're all free, complimentary, and you can check them out and learn a little bit more. So our systems use a really high intensity, non-coherent light. So these aren't lasers in a sense, they're LEDs, but they're a specialized LED called a superluminous diode. So the terminology laser therapy is outdated. It's not really a good term because the effect of red light therapy doesn't have to come from a laser. In fact, it's very helpful to make it come from an LED because they're safer to use, and you can pack them closer together and treat a much larger surface area in one go, as opposed to lasers where you have to move them all around and hold them, and it's just a big headache to some degree, not to mention that anything over 5 milliwatts is restricted, or it should be restricted to the regular consumer. And so therefore you're very limited as to what laser you can get. Now, when you're treating near the face, which, you know, what you would probably do if you had temporomandibular joint disorder, if you had other issues around your jaw or your face, we do recommend to wear the safety glasses to avoid some irritation. It's not going to damage your eyes, but it's bright, and that light can irritate it, much like looking at really bright lights. So we recommend that you don't do that. Also, if you do have a history of a seizure disorder, flashing red light should always be avoided near the face for obvious reasons. Most of our protocols, the red light is continuous wave or flashed at a really high pulse rate, so you can't see it, but there are a few that are pulsed a little bit lower, and you'll see it right away because you can see the red light flashing. Those shouldn't be used visually on someone that has a seizure disorder. Also, in general, red light therapy should not be used directly over a growing fetus. Any energy device shouldn't be used around a growing fetus for obvious reasons. And also, it's important to understand that the wavelengths used in photobiomodulation typically do not interact with photosensitive medication. You know, the medication that the pharmacist says, stay out of the sunlight, you know, don't go sunbathing, you know, don't go to the pool or whatever. That's because the medication can interact with ultraviolet. Usually it's ultraviolet. It's rare it interacts with any other wavelengths. But I always do say that if you're on a photosensitive medication, talk to the pharmacist or whoever prescribed it, and make sure that it doesn't interact with the wavelengths used in photobiomodulation. I've never come across that. I don't think it happens. In fact, I would be extremely surprised, but I always say be safe and just double check that. Don't use it over actively bleeding tissues, you know, so if you have a cut or something you want to try and heal faster with red light therapy, it will really help, but let it coagulate before you start using it. So give it a few hours before you start using it, because remember, it causes vasodilation. So you don't want to dilate the blood vessels while it's bleeding because it makes it bleed more. You shouldn't use the equipment over an area of known carcinoma. You know, red light is stimulatory. Whether or not it's stimulatory in vivo inside the body for cancer is a debate that hasn't really been answered with science. We don't know one way or the other. It's highly doubtful, but we don't know. And of course, you know, you don't want to do anything that you don't know the effects on cancer. So if you have an area of cancer, don't apply it over the area. You can apply it over other areas that don't have cancer. It's not known to cause cancer or stimulate cancer, you know, start it up in the body or whatever. That's important to understand, okay? Don't treat over your thyroid gland. It's just a small little area where your Adam's apple is, because that's extremely sensitive to light, and it may have an effect on the thyroid gland itself. So we don't want to do that. Technically, our equipment is not approved for infants and young children. So, you know, I wouldn't say it's recommended for that. And you can use it safely over embedded, you know, implants or screws or pins or rods or whatever it is that's inside your body, because the light isn't intense enough. It doesn't cause a thermal reaction, right? So it's safe to do that. In fact, you know, if you have a bunch of sutures or staples that you have after surgery, you can safely use the light over that area. It's not going to heat it up to any degree. It's a really important tip, and that is make sure your skin is clean. By that I mean of oils or balms or medications, to avoid any negative interaction with the silicone light pad. because silicone is sometimes sensitive to certain things, and you don't want to have any interaction of whatever could be in the cream with the light as well. So just make sure that the area does not have any of these things on the skin. So when you're using your device, electricity powers it, right? And sometimes it feels warm, and that's okay. It's a nice soothing warmth. But this is not really, well, it can be a little bit helpful for sure. That's not the main effect of what we're trying to do here. And that heat isn't coming from the light. It's coming from the electrical current driving the LEDs. So it's important to understand that when you're using the equipment, you don't want to block the ability of that device to get rid of or dissipate the heat. And so therefore don't block it with pillows or clothing or lean against furniture, that kind of thing for any period of time, because it will start to get warm. And, if you're using it and it feels warm or too hot, then you're going to have to stop and let it cool down. But typically that's not the case when you're using the equipment. But if you're inhibiting its ability, and in fact, if you look at it, you'll see these grooves that are built into the top surface of it. Those are heat sinks to allow the light or the heat to kind of get more contact with the surrounding air to dissipate heat. So let's say you're treating an area and you're using it for, many sessions. Sometimes you need to let it cool down a few minutes in between use before you use it in another area. And again, that's because the electrical current causes some heating and you want to let it cool down a bit for a few minutes before using it. Obviously, you don't want to use it in wet conditions, if it's raining out or in your shower or your bathtub or wherever it is that you're getting wet. It's not waterproof and it's electrical. So I don't think I need to say more. I would advise not to plug it into your car. Nowadays, cars have plugs that you can plug stuff in and use it. The red light's super bright and it can be distracting. And you don't want to get a distracted driving ticket because you're using a light device in your car. And when you're handling the array, it's really flexible and you can get it around a lot of different areas. What I'm not going to recommend is you bend it 180 degrees to try and wrap around a little tiny pinky finger. The reason for that is the more twisting, there's an electronic circuitry board. If you're interested in what it looks like, you go to our homepage and you'll see all the different layers that are built into that array. It's quite complex to make. We make them by hand. The reason why these things are so expensive is we're not buying these off the rack like 99.9% other manufacturers that just pick and choose from China and sell them and say that they're theirs. No, these are handmade by us. We pour the molds. We do everything ourselves. We embed all the electrical stuff in there by hand, by skilled people. And therefore, it's quite complex and you don't want to abuse it. You want to make sure they last. Don't pull or wrap the cables around the treatment array too tightly, right? So these cables are meant to be flexible, but again, the more you pull, the more you bend, eventually they fatigue. And obviously, don't open it up. If you see an error or something like that, give us a call. We have some brilliant people in our service department. They can help you out and get the things repaired if it needs to be repaired or walk you through what might be the issue. These aren't designed to treat your eyes. I get emails all the time about, can I treat my eyes? The reason why they're asking that is that because there's been some published research about treating different eye conditions. Yeah, okay, that's great. There's some research, but we're far and away from being able to understand how to do that. That's why we're doing clinical trials. In fact, we have one going on in the Philippines for dry macular degeneration as part of a learning process to see if, in fact, we can determine this. But right now it's not indicated, so I'm not going to recommend them to treat your eyes. Again, I do recommend those dark glasses that come with your system, or if you're sensitive to light, because that light's pretty bright. I mean, most of the time it's covered, right? You're not going to see it, but if you have it in your face, you might see it. I think I already mentioned about the driving thing. And also I wouldn't leave the device unattended in operational mode for, a toddler to come by and start playing with it, or your cat to pick it up and bury it somewhere and never to be found again. Actually, a cat, you know what a cat would do? It would probably take it up to the top shelf somewhere and then slowly push it off the edge and then break it. That's what a cat would do. A dog would probably chew it and then bury it or eat it. And obviously, keep out of reach out of children or incapacitated individuals that shouldn't be using the equipment. Cleaning wise, a tip on that is we do recommend an alcohol wipe, or preferably a 70% alcohol solution, obviously a non-abrasive cloth or a paper towel to clean the system, clean the pad and disinfect it after use. A mild disinfectant can also be used. Obviously, you don't want to immerse the treatment array in water when cleaning it. The straps that come with it, they can be used and cleaned in a washing machine. Just don't throw the whole system in there and just allow them to air dry. Obviously, you don't want to avoid extreme temperatures, whether it's hot or cold. So if you're going to the Antarctica and you're going, camping out in -40, I wouldn't bring the system along. So as far as how to use it, obviously there are anatomical areas in the personal system, and they correspond to different regions you're going to treat. Usually it's around 14 minutes of treatment time over one area, first red, then infrared, usually 6 minutes of red and 8 minutes infrared, a little bit longer for the deeper areas like the hip and so forth. Some areas are a little bit shorter depending on the protocol. So when you're using the personal system, there are 4 stimulatory levels. Now, these involve different dosages or energy density of light and pulse rate of light. So we always recommend to use that lowest level, stage 1 first, and then gradually increase. And I'll talk a little bit about that shortly. In the new device, the Miniport Home, there are 6 stage levels for each anatomical area. And again, start with the lowest one and then work your way up. You may find a specific level that seems to work best, and you can stick with that until it's not seemingly doing its thing, and you can then try a different level. Sometimes the body accommodates, and then you can try different levels as well. So always start with that level 1, regardless of what the scenario is. Give it some time. Give it 4 to 8 sessions before you decide to change anything. If your symptoms are improving, then use that stage. Remember, all the protocols start with red and then they go into near infrared. So again, you have to now allow enough treatments to ascertain if that stage is working or not. This can take several weeks depending on what you're treating. So if you're treating chronic arthritis, this can take a while. But if you're treating an acute, injury, you'll notice changes much quicker. Be patient and allow appropriate time for the tissues to heal. You have to have realistic expectations here. If you stop the treatment area for any significant period of time, then restart it back at that level 1. Okay, so again, once you've reached a plateau and you feel that maybe the benefits are waning, then you can go back up a level, and then sometimes you can go way back down to a level as well, and that might be beneficial as well. Sometimes taking a short break, maybe a week or 2 weeks before starting again, may also be beneficial, especially for those chronic conditions. And this may increase the sensitivity of the tissues that you're treating and be helpful. If you're treating an area that is acutely injured or inflamed, like, a sprained ankle, for example, there I recommend applying a cold compress or ice about 10 or 15 minutes before you do the BioFlex treatment. The reason for this is the cold decreases the localized circulation, allowing the light to actually go deeper into the joint and the affected tissues, because blood absorbs a lot of light, even near infrared to some degree. So the less blood you have in the area allows you to target and get more light deeper as well. If you have an acute injury, let's say, you bent over to pick up that broken device that your cat dropped off the shelf and you strained your back and now you can't move. Oh, so you have an acute muscle strain, right? So in those scenarios, you can treat twice a day. Normally it's once a day, but in those scenarios, you can treat twice a day if something's really acute. I'm going to say space out the treatment 6 to 8 hours before the next one to allow the bodies to start to utilize the treatment energy. Whenever you're treating a joint, whether it's an elbow joint, a wrist joint, a knee joint, if you're treating a joint, you want to treat all the way around the circumference of the joint. So it may require, like 2 placements, top and bottom, or whatever the scenario. And that's really because inside a joint, you'll have inflammatory exudate, inflammatory stuff going on there that in order to effectively treat it, you want to get light angling in from all the different angles. So it will be way more effective if you treat all the way around the joint. Okay. Avoid treating the same area multiple times. So if I'm treating an area, say the wrist, I want to move it to a different spot, not over the same area. So don't keep treating the same area. And really the reason for that is, too little light does really nothing therapeutically, but counterintuitively, too much light actually has no benefit of photobiomodulation. Photobiomodulation is a dose-dependent therapy. That is, there's a window of light dosage that's really effective. Too little, nothing. Too much, nothing. So you need that right dosage. And that's why, if you don't know what you're doing, you could apply too little and get nothing. You could apply too much and not have an effect, and then say, oh, it's not working. Well, it's not working because you're not providing the body the ability to work. So you have to be careful about that. Remember, light therapy doesn't have any side effects. Occasionally people say that, they did the treatment and then it feels a little bit worse the next day or a little bit later, and then it goes away. That can happen. And to be honest, it's hard to say why that happens. I mean, it might be because that, it has an effect on the inflammatory pathway. It's hard to say, but typically that just happens the first time you start to use it, or you go to a different stimulatory level for some people. Just be reassured there are no side effects. And sometimes that's actually a good thing. If it persists, then I'm going to suggest you go down to a lower level, or treat yourself less frequently, or not the full treatment time, because you may require a little bit less dosage to be effective. The other tip I'm going to suggest is make sure you make good contact with the skin when possible. All right. The whole point of this exercise when you're using light therapy is to get light deep to the skin and into the tissues that you're treating. All right. And so to do this, you want a direct contact of the equipment. Sometimes that's not possible. I had an email the other day and someone was saying it's hard to get a certain area, whatever, and it can only get part of the array on the area. I think it was the neck or something. And I said, that's okay. Just get as much as you can on the neck. That's fine. Even the areas that don't make direct contact, you're still getting light on the surface of the skin. Not as good, but you'll still get some benefit that goes into the tissue. So that's still okay, but you want to try and get that light into the tissue as best as possible. There are straps that come with the equipment. There's different ways of making sure it adheres to the area, usually the straps. So make sure that makes good contact. Remember that light therapy stimulates cells and tissues that are under metabolic stress, right? Inflamed, injured, what have you. I mentioned that earlier. So in chronic progressive conditions like arthritis, they require ongoing treatment. In fact, it takes at least 40%, if not more, damage of a joint before you feel any symptoms. So you're walking around, a lot of people are with arthritis, not even knowing it. And then they start to feel symptoms. And now they go, oh, I have arthritis. I want to, get rid of the symptoms quickly or whatever. It's like, it just took like your whole lifetime to get to that point. Let's be realistic about how long it's going to take to get benefit and how to treat this condition, right? So light therapy can help slow the progression down of arthritis. It can help reduce inflammation, it can help with pain, and it can help with swelling. It's the only type of therapy that can actually help repair some damage done by arthritis to some degree. But The worse your condition is, the more progressive the issue, the more challenging it is. So you need to be, realistic. Even if you're feeling pretty good, I would still treat because you have the arthritis. It's still there. It's not going to go away. It's just that you're feeling better, and that's fine. That's great, but it's still there. So continue to treat to keep it as healthy as possible. For some reason, people vary widely in their response, right? It's kind of like a bell curve. Most people respond here, and then there's people that respond at different dosages or what have you. And that's okay. We're not sure why that is. It could be hereditary, different reasons. So finding the optimal window of stimulatory dosage can vary quite widely. So you need to try different levels, different dosaging parameters, and then you'll oftentimes start to notice the difference, right? So give it some time. And remember, just don't start treating yourself because you have a little ache or pain and you think it's just X, Y, or Z. You really need to know what's going on, right? Because that could be something serious. You don't know. So make sure you get a good diagnosis. And they say, hey, yeah, you got degenerative disc disease in your spine. It's mild. You can get some physio or whatever. Light therapy, yeah, that's a great option. And now you know what you have. That's fine, right? But don't try and Dr. Google it and then start treating it, because you just need to know what you're dealing with. And really have realistic expectations. Light therapy works extremely well. It can take sometimes a little while for you to notice the benefits, sometimes many weeks, sometimes months, because you're trying to make physiological changes. You're not trying to take a pill and block the pain temporarily. If you want to do that, take an Advil or Tylenol and blow out your stomach and have all sorts of prolonged negative effects from that. Being sarcastic, obviously. So, do other things, do exercise, do all the things that one should do. It's always a multifaceted approach to treating. Hopefully you enjoyed today's webinar. Next one is in December. That's the last one of the year. And it's on all the research that I've looked at and read, which is a lot. I don't know, hundreds and hundreds of papers this year. And I'll present some of the best and most interesting of that research. Gives you an idea where light therapy is headed. So those of you who are interested in this topic, just in general about red light therapy, I think it should be a pretty fun webinar. That's on Thursday, December the 7th. And if you have any questions, you can email me. If you have our equipment, you can email me with respect to support as well too. A few questions here. Why do some of the settings pulse when the red is on and some don't, e.g. the head? Yeah, so I mentioned earlier, the protocols have been developed and really based on pulse rate. The reason why for red light especially, we tend to have a continuous wave, but sometimes it's pulse, is really because red light doesn't go very deep. And its main target is the circulatory system. And therefore, because it's always passing underneath the light, you're not constantly treating one spot. So the pulsing isn't as effective. But to treat facial pain, the target is more the nerves, which lie underneath the skin. And so because it's a static target, the pulsing, especially in the first few protocols, we tend to pulse it in order to target those pain receptors. What about blood cancer and systemic effects? That's a good question, but of course, the origin of blood cancer is the bone marrow, and we're not treating the bone marrow. So, the odd cancer cell that's floating by or whatever, light's not going to do anything to it. And we still don't know the effects of light on cancer, but really the understanding here is that we don't want to treat a static, like a tumor or an area where there's cancer sitting there. But bloodborne cancers, that's a completely different thing. We're not putting light into the bone marrow. So that's not an issue. To treat the inner and outer hip, it should be 6 to 8 hours apart. Inner and outer hip. I'm not sure what you mean by that. When I say 6 to 8 hours apart, I'm just talking about if you want to treat the same area that's acutely inflamed or painful, you can do so, treat the same area, but give it some time. That's 6 to 8 hours. If you want to treat one area of the hip and then another area of the hip, there's no time frame there because you're not treating over the same area. It's only if you're treating over the exact same area. All right. Thanks, everyone. I do appreciate you tuning in today, and we shall see you hopefully for the next webinar. Take care, everyone.